Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
A little over 3 years ago, I had shortness of breath, and I initially they all attributed to my lungs because when I was in the military on board a ship built in 1940s, there was a lot of rust, a lot of chipping of lead paint. They did testing for a good 2 years. We weren't able, they came back to the conclusion my lungs are in perfect health. And then they said, okay, what other part of the body? And they found that I had substantial blockage, my aorta valve, three of my veins, and one of my arteries, were clogged. And it went down to Dartmouth, and they were great. Their attitude was, we're going into your chest once. If it needs replacement, we're replacing it. I weighed 200 pounds. And I weighed that much, and my joke was, my doctor tells me I'm 20 pounds overweight, but it's been that way for the last 4 years, so it's okay. At least in my mind, it was okay. So not thinking that a weight loss was really that critical, because I was active. So my change of habit was not only seeing what I'm eating, but most important, how much I'm eating. Stress on yourself is really, I said, our worst enemy. And we're so easy, that we're able to create and manifest that stress, in ourselves. There's a couple of times that I felt depression, and I wasn't alone. I was with family or friends, and I just felt like I can do nothing. It's all within yourself. You need to figure out, okay, where do I go for help? Who do I talk to? How do I get this out of me?